This conference will now be recorded.
Sorry, setting aside time to be on the call is very important to us. So we very much want to thank you for that. And we just want to do a roll call here to see who is on the call. Is Carol McGowan on the call?
I am on the call. Hi.
Hello. Just want to thank you for being our funder for the CDC. And then I'm looking through the list here. I think Grace is the next one. Hi, Grace. If you can introduce yourself really quick.
I'm Gracie. I am the WIC breastfeeding coordinator in San Francisco, and I was the California Breastfeeding Coalition board member.
Awesome. Thank you.
Thank you.
Lindsay?
Lindsay? Me?
Okay. Yes.
I'm Lindsay Wilkes, and I am a member of the Missouri-Kansas Black Breastfeeding Coalition, and actually have just relocated to Atlanta, so I'm looking for opportunities to get involved down here. And I was on the planning committee for last year's conference as well.
Awesome. Thank you. And then Tamika is on. I don't know. Can you unmute or not?
I think Tamika said she's in, today her line will be muted. She's at her job, okay. So she's gonna, but she's chatted us and said hello.
Hi,
Thanks
Tamika.
for being here, Tamika.
Okay, is any staff on?
Go ahead, Miriam.
Hi everyone, this is Miriam. I'm the Coalition Relations Coordinator, and I'm happy to be here.
Hey everyone, it's Kinkini. I'm the Coalition Relations Director, and happy to be here with you all. Wonderful. Is there anyone else who's joined by phone? That we can see you on the panel. Okay, looks like we got everyone. Thank you, Stephanie.
You are welcome. I'm going to go over our community norms that we do every single call. We just want to reiterate what our community norms are. So everyone participates, step up, step back, participate fully and evenly, listen well for deep understanding and respect, be fully present and open to new learning, speak your discomforts, place tech on silent and stay checked in, share using I statements, and share responsibility for the success of each meeting.
Thank you.
You want me to do this slide, Kinkini, or do you want to take over from here?
I can do that. Thank you so much, Stephanie. So today's meeting, hopefully we can wrap up quickly. We wanted to give you some updates on where we are with the conference planning and what's happening since our last meeting. We also have some speaker and session updates for you. We will review a draft of the NBCC program today, just so that you get a sense of how the tracks are working out and what the flow and content of the program will be. Quick updates on the award. And then looking ahead, we'll look at what's coming up for the staff to do in the month of March, and then what's coming up for the CPC to be doing this month and next month. Wonderful. So we'll do a begin with planning updates. Miriam, do you have Eden's picture? We have a very special guest with us today, and we wanted to see if we could show you her picture. Lindsay is a new mom of 6-week-old Eden Tilly. Is it, Lindsay? Did I get that right?
Yes, that's right.
Okay, and Miriam, do you think you can show us a picture of her?
Oh, how cute!
Is that gorgeous? Well, welcome, Eden. We are so glad to have you on our call with us today. So thanks for that. Okay, so um, updates. Let me give you a quick update on our proposal. So our proposal review committee has been super busy. We met last week and it was so hard to select. We had 37 proposals, and we had to really cut it down, and select because we have such few tracks. So thanks to Lourdes, Titina, Stephanie, Moser, and our staff team for helping. We did have three of our proposal reviewers who had urgent family issues and were unable to do the reviews. So our thoughts are with them, and a big thank you to staff who jumped in and helped out with the reviews. So all of the approval notices have been sent and people are accepting. For those, there were so many wonderful ones that we could not select for the breakout session. So we always offer a poster or table topic options, but we are also kind of flag them to present webinars either through the CDC USBC hosted 222 or any of our series. So some of you, many of our proposal submitters who we will not be able to showcase in the breakout panel over here will be, we'll be contacting Miriam, or I will be contacting them to set up a webinar at a time convenient to them. As far as applications, we have 3 award categories. We added a new one this time. So we've had the Tribal Trailblazers and the Emerging Leaders now for the last 4 conferences. But this time we added the Cultural Change Maker category. So these are awardees that represent distinct cultural groups, Latino, Asian, African American, Native. So we hope that we've got a good number of applications, and the award application reviewers have been busy with their reviews, and we will be meeting during the week of March 11 to finalize the awardees. And then before we review the draft program, Miriam, did you want to share a little bit about the CSAs or the continuing education units?
Definitely. So just a little bit about the CSAs. I've been making phone calls to remind people that the surveys for designating their coalition-sponsored attendees is going to be due on March 17th. This is totally different than the membership process, which there have been a couple of questions about. So if any of you have spoken to your state coalitions and they have questions, please let them know that the membership is different and that the survey is due on March 17th. Excuse me. And then a little bit about the CEUs. We are continuing to work with the CDC on that, and we're also working independently with the CPC and the Commission for Dietetic Registration. We're going to continue to be working on these up to the conference, and now that we have confirmed our speakers, the process should be able to move along, and we hope to give more updates at the next CPC meeting.
Thank you, Miriam. So for some of you who might want a little bit of background, through CDC funding, every state coalition gets subsidized discounted rates for 2 attendees from every state coalition to participate in the National Breastfeeding Coalitions Conference. And so now, because we also launched a membership drive, and local cultural coalitions, tribal coalitions are all coming into the fold of the memberships, there's been a little bit of confusion. Sometimes state coalitions have been asking, has that discounted option gone away? Or some county coalitions are asking, now that we are members, will we be getting the CSAs as well? So we've just been trying to get the messaging out to all the state coalitions, whether or not you're a member, officially a member of USBC, the coalition sponsored attendee discount that we've been providing for the last so many conferences still holds. And then we are also working with our cultural and tribal coalitions to say that at this time, because we don't have a mechanism, we have these award systems where, eight 7 to 8 tribal awardees are supported to come to the conference, as well as the cultural change makers and also our emerging leaders. So we use the awards for these other categories while constantly looking for funding. Our USBC staff team, of which Miriam is one of them, is constantly looking for other sources of foundation or other funding so that we might be able to support greater numbers of coalition members and leaders to attend. Any questions so far about the proposals or awards before we dive into the program? So excited. Checking the chat. Okay. So let me pull this up. So this is our program schedule, and we've made a slight change since we spoke to you last time. So remember when in either the February meeting, when we had first shown you the program, we had thought that the regional meetings might be folded into the membership meeting, and we just realized that is not a very feasible idea. We might not have a lot of coalition folks still coming into the membership meeting. So as of now, Thursday, June 13th is the USBC membership meeting, a separate registration, completely separate event, but we hope that folks who come to the conference are also able to attend this, especially the breastfeeding coalitions that are applying for membership and becoming members. So the USBC membership meeting is from 10 to 5. The membership meeting ends at 5, and we have a soft opening for the conference, which is the regional meetings happen from 5:15 to 6. So we have all of the regional meetings as well as the Native and Cultural Coalition awardees come in and have, that's a good place for them to meet each other. There is usually a facilitator for any new group that's meeting, so we'll be tapping our host committee, which is you or crash committee, to be doing some facilitation work during the regional meetings. Then we have dinners on your own, and then we do the dessert reception and the exhibits open. So it is a late night, but that's when we have the official opening of the exhibits and some networking time, informal networking time for folks. And then the conference officially opens after the soft opening on Thursday evening. Official opening is on Friday morning. We heard from our West Coast folks that starting at 7 was too early, so we are doing breakfast at 7, no table topics at 7 in the morning because very few people show up. So we are going to be doing the table topic discussions over lunch. We do the opening in the morning, 8:30 to 9. And so any suggestions folks have for local, for an opening ceremony like we had in the last 2 years would be fantastic. And then welcome remarks from our board chair and from our conference co-chairs, Stephanie and Taitina, followed by always the opening from CDC. So we hope, Carol, you will do that opening for us, unless there's someone else from CDC who's also going to attend. And then immediately after the opening from our, main funder and supporter for all of the coalition and breastfeeding uh, work that we do, we will go into the awards ceremony. So we will do an hour of awards and then a break. And then we come back and we have the anchor keynote. At this point in time, Dr. Joy DeGruy was our first choice. Her fees are a little high, so her speaker fees for our presentation is 8,500, and our entire budget for speakers is 8,000 at this time. So it's a little bit beyond our reach. It's 10,000 for a half day training. And we were trying to see, my goodness, could we, like how we had Dr. Jan Marie Garcia, who came and did work during the membership meeting and also during the conference, if there's any way we could do that, but we just cannot justify $10,000. We simply don't have that at this time. So I have written to Dr. Kamara Jones, who was she was out of town the week before last, but I've followed up with her. So if anyone has any pull or connections with Dr. Jones, Kamara Jones, and wants to, ask her, I've already sent official invitation out on behalf of USBC, but a word in with would be really helpful if you know her. Is anybody here knows Dr. Kamara Jones? Okay, thanks, Danica. And I am, instead of just saying no to Dr. Joy DeGruy, I'm working to see maybe she could do a webinar for us at some point in time so that we could still have that. But how might we be able to, use the amazing learnings that she provides, but within our budget. We are hoping by next year to have a slightly bigger budget for speakers, so we might be able to afford that. And then again, Friday will be after the anchor keynote that we have, who will speak to the theme, moving from equity from theory to practice. The next whole group session, we hope we are planning to be a dads, partners, men supporting breastfeeding group. So Robert Lee, that Stephanie, you recommended him, you and Titina. So I've been connected with him, and we're very glad that he'll be able to present. Also, someone from Reaching Our Brothers Everywhere will be able to present. So that will be, again, so the morning until 2:30 or 3:30, we are all in the same room, the whole group together. And then the last segment of the day will be breakout sessions. So at this time, we have 3 different rooms, 3 concurrent rooms. And the way the proposal reviewers have selected the proposals, we have one that will be talking about addressing barriers to access. We have something on donor milk. We have tailoring in interventions based on social determinants using a GIS program, which was a really good study, again, of finding really hard to reach groups and how you can preempt and see how do you provide prenatal education during that to that group and the continuity of care postpartum, and then others. So then and then again, Voices of Urban Mothers. This was another one that's using technology and things to gain, to improve access. So that's one session, we have another one, breastfeeding support across different contexts, so among incarcerated women, among in childcare settings, in schools, and then also, in different, in non-traditional workplaces. So this was a similar track. This one was harnessing voices for policy change, and this one, turning anger into action, is by Kimberly Seals Alice. And she talks about how the anger of the general population sometimes is used for harnessing good, like you had the Women's March, or you had folks galvanizing against, a Supreme Court justice, or, for women's issues or for economic issues. And similarly, sometimes the anger and the disappointments of Black and Brown communities are seen, are not harnessed or not respected, dignified, honored in the way that they are or justified. So how do we use this kind of, anger and disappointment at the system to advance breastfeeding and to advance other policy initiatives? So that she's also, Kimberly Seals is also presenting at the Breastfeeding and Feminism Conference, but this is the same one, so that should be really good. We have another organization that's, this is 0 to 3, that's talking about paid parental leave and the first, in the context of the first few months. So really great session again. And then this is on minority maternal mental health and why it matters, and why when we advance policies, really looking at screening and support for maternal mental health is so essential, especially for communities that suffer the burden, disproportionately from systemic racism. So we have one set of breakouts on Friday evening, and then we have the special interest meetings in the evening, dinner on your own. We have the open mic night. We may have a movie screening. We've been approached by a documentary filmmaker to ask if we could be screening a film. So we'll bring that to you next time at the next meeting and see what your thoughts are. So that kind of is our Friday program. Any questions so far? Any thoughts? And these, just wanted to let you know, these things are not set in stone. We might change the themes a little bit. I couldn't kind of find where donor milk would fit well. We want to do 3 per session. We didn't, things might switch around a little bit, but these are kind of just a draft of what we are thinking the themes would be for each of these rooms and how we are clustering the proposals together. So then moving on to Saturday. Saturday we have the awards ceremony. So if you noticed, the last year we had the awards ceremony after lunch where we did the awards in 1 hour. This time, because we have 3 groups, we don't think we could do justice to the awardees by trying to squeeze that into 1 hour. So we've split it up. So we have 1 hour on Friday and 1 hour on Saturday for the awards ceremony. Similarly, there were a few proposals that we felt would be, because they have a national scope, they span many states, and we haven't had webinars on them, or we haven't had a lot, our network hasn't heard that we thought these could be in the general plenary session. So CHAMPS is doing their update. That is for those who might just to clarify, CHAMPS is Communities and Hospitals Advancing Maternity Care Practices. So they have, lots to share since the last conference. So we have CHAMPS, the Children's Healthy Weight Coin, and the National WIC Association, which are our public health partners in the general plenary session. Similarly, we got 3 proposals that spoke about distinct population groups again, which were our priority population groups. So Minnesota Breastfeeding Coalition is going to speak about, their Hmong breastfeeding initiative. And Sisters on the Border is the binational breastfeeding coalition that is actually a coalition that contains both areas of Texas as well as Mexico. And given the issues in our southern border, we thought that having the binational breastfeeding coalition speak about how they are supporting moms in the border areas, how they are building breastfeeding and advancing breastfeeding would be really timely to do so. And then also we had a proposal on breastfeeding within the Appalachian region. So these were, we thought, that we could call this a breastfeeding across cultures, and then put this in the whole group session. So is Taitina on? I'm trying to see if I could have one of the reviewers out who could speak to this. Taitina, are you on? Hi, Sissy. I still see a chat from Sissy. But one of the things that happened during our proposal review process was that, again, the quality of the proposals was so good. And last time we had only 1 day of breakouts. And if we had 1 day of breakouts, we could have selected only 3, 3, and 3, 9 out of the 38 that were submitted. And the proposal reviewer said that's impossible. If we have to give up some general plenary time and have more peer sharing, let's do that. So that's why we have breakouts on Saturday, we have breakouts on Friday, and some of these some of the proposals that were also scoring very, very high, we pushed them into the general session so that we tried to get as many as we could. So that was a very creative way in which we worked through how to ensure that we get. So for, in our February meeting, we had spoken about having external experts come in and talk about breastfeeding across cultures, having Lorena Gonzalez speak about Latino breastfeeding, having the professor from Yale speak about among Asian communities. But then when we saw our own peers presenting these, we thought that maybe we should have the general plenary session breastfeeding across cultures with folks from within our own network. So how does that sound to you all? Is that a good decision?
Thank you, Kintini, for sharing this. It's so rich. The agenda is so rich. I love it.
Thank you, Grace. Thanks, Tamika, too. Yeah, we just did not have the heart. There were just so many that I had to send the notice saying we could not accept. And it was just, they were I mean, literally, we were just trying to see if there were any duplications. How might we do that? So um, we're very happy um, with the with how the program is shaping up. So partnerships to
Hey,
advance.
can you hear
Yeah,
me? Hey, I had a question.
sure.
I know it's probably a little late this year, but maybe we could do it next year because we've had so many people that are like phenomenal that have, submitted for speaking. Is there a
Mhm.
way that maybe we can have like a webinar series that people could record, and then once you register, you can have access to it?
Yes, is that Sissy?
Yeah, that's me.
I should say yes. So yeah, all of the ones that we aren't, haven't been able to accept have been asked to do table discussions, speak at
Okay.
it at the open mic, and also get a webinar option. So
Okay.
these are
Yeah, because I
the
know
options.
that
Yes.
would be great for a lot of people to just be like, okay, I got to talk to you for 5 seconds, and then they can listen to like a full webinar from them later.
Yes, yes,
Okay.
and so thank you for that. Yes, Miriam and I will be making sure that we follow up with and schedule the webinars throughout the rest of this year as well. And then on Saturday, we again 11:30 to 12. This would be probably be 11:30 to 11:15 to 12:30 would be our breakout sessions again. This room is Partnerships to Advance Equity, Native American and African American Built Community Support in Kansas. And this one is more from the point of view of the Kansas Breastfeeding Coalition and how they are supporting others. So we initially we thought we could put this across sisters, across cultures, but then this is much more presenter who is white, speaking for Cancer's Breastfeeding Coalition, talking about partnerships. So we had this in the partnerships breakout session. Uh, um, the second one, Emerging Leaders in the Lactation Profession, is a fabulous one again from the Boston Medical Center, and they are talking about how they work with the communities to provide opportunities for CLCs and others to work in hospitals, work in clinics, work in the community setting, but really a wonderfully inclusive process of harnessing the wisdom from the communities. And then Better Together is from New York City, which is, the New York City Health and Hospitals, the New York City Public Health Department, which they call the mental hygiene, public health and mental hygiene department has this, it has a hospital collaborative that works to make New York City breastfeeding friendly. So they work on hospitals, practices, even those that are not on the pathway, but how do they improve their breastfeeding friendly practices in hospitals? It's about workplace support, it's about for their own employees as well as for their patients. So just a really good model of how a collaborative is working together to make New York City breastfeeding friendly. And then room B, we thought would be we got three incredibly good ones on breastfeeding in the African American community. So, of course, this is from Rose, Miss Kimmery Bug, Dr. Bug, and their training model. The National Medical Association has an approach to health disparities, which is really comprehensive, and they've never presented at the national conference, so we are very excited that NMA is presenting. And then also this is a study from the PRAMS data to look at some of the reasons for the disparate breastfeeding rates. But the best part about this is also it has strategies of knowing the data that we do, what might be some good strategies that we need to invest in. So all of these are very solutions driven, has tools, techniques, worksheets that they are providing. So it's very exciting. Finally, room C, and again, having 3 concurrent ones, I know it's so hard because you're so torn at which ones to go to, but we wanted to make sure we didn't squeeze too many. We were doing only 3 per session. Room C is teaching the WHO code to community health workers. This is from Lourdes Santabaya from Puerto Rico, who's going to talk about like how sometimes we interpret things in ways that we don't do justice. So we will be working with her and to this is specifically doesn't say it does say a fair amount about the code, but mostly in the community settings. How do you train community health workers on this? And then reinventing the baby shower is actually it doesn't, the title doesn't belie what it is, but it's from the Nemours Healthcare Foundation and the healthcare system, and they talk about continuity of care and how they use a baby shower to reach out to their prenatal population, to get them to educate them about breastfeeding, to get them into their ambulatory settings. So just a really good way of how a hospital system is working with the community. So amazing clinical community linkages on this one. So it's much more than a baby shower. It's really building that continuity of care. And then Lamaze has this one about their new and updated commitment to equity, which is also really, really good. So those are the breakout sessions, and then we just have our closing plenary, and it is really closing it down to how do we do this grassroots to treetop. So we are still looking for a national level speaker who can speak for maybe 15-20 minutes, and then we want to lift up the work of the local coalitions there, DC, Maryland, Virginia, and what they are doing. So that will be the end, kind of giving a tip to the team and how that works from grassroots to treetops. So quite the program. What do you all, any thoughts? I'm seeing some comments, yeah. Stephanie.
Looks great to me.
Thank you, Stephanie. So I think what we are going to need your assistance on is as the program gets refined, I'll send you a draft before the next meeting. By this week, I hope to have our opening anchor keynote speaker confirmed, and also closing. So the closing, we are looking at all of the options that you had, the options that we had spoken about for our keynote. Once we have those two set, if we have options for that, I'll send that to you for feedback. But basically, this is the program as it's shaping up. Next time, we will be speaking about the side events that we do. So, yeah. So Abigail was one of our suggestions that came in, but we think that we might have she might be, from what I've heard for folks who've heard her, that she is a wonderful storyteller really great for one of the any plenary that we do in the middle of the day, but possibly for opening or closing, we are looking at Dr. Joya Kriya or Jenny Joseph, our midwife, who's also come highly recommended. So I'll keep you posted about that. If you have any other ideas about who might be a local DC-based closing plenary who's going to speak and send us inspire us to action, taking equity from theory to practice, speak to the theme, do let me know. Tamika, if you have any suggestions, do send us, or anyone who knows in the DC area. Thanks, Tamika. So our planning calendar is this month, and the first half of this month, we finalize pretty much all of the program details. And because we are also doing the continuing education units that we haven't done before, so we need to be specially, cognizant about having all of the paperwork and all of that done if we have to have because of the continuing education unit. So this month we'll be doing that. The online conference registration will also open this month. Then in April, we will be doing side events, the identity caucus spaces, the opening closing ceremony, the awards ceremony, the open mic. So that's what the committee will be discussing, and also we'll be setting up a time for the host committee training. We usually do a training for facilitation, which is a webinar training that for our host committee, which is the host committee is the USPC board, the USPC conference program committee, the USPC crash committee, and the staff. We form the host committees, and we have a lot of on-site roles that we will be playing. So April and May is when we are looking to see when we can do some moderator training. So we'll be bringing you some options for trainers who might be and schedulers so that we can find a time either late April or early May for us all to participate in a facilitated training. And I think that's pretty much are the updates from on the conference. Next week should be very exciting with the awards. And so in a follow-up email, we will, Miriam or I will let you know about the awardees as well as the plenary speakers. Anything else that's coming up for you all that as staff we should be doing, or as CPC we should be supporting you with?
Kinkini,
Yes,
this
please.
is Grace. My question might be a little bit crazy. I noticed that you have training for the host. Is it possible to have a virtual tour of the hotel for people who are going to be ushering and greeting, or anyone that the participants might have the opportunity to ask them where to go for different things?
That's such a great idea, Grace. Absolutely. And we could totally do that because this is one hotel where the main room is on one floor, but the breakout rooms is on another floor. So we just having an orientation. And like last time, we did a sign up genius where we had so many roles, right? Host committee sitting with the awardees, host committee, budding up for dinner guests, but also just making people feel welcome and having them find their way to the regional meeting rooms and to all of that. So fabulous idea. We'll make sure that we have the layout and that when we do the facilitator and host training, that we do a quick look review of where the ballroom is, where all the other rooms are, and how the traffic will be, where the exhibits are, and how we'll be, moving and directing traffic and our participants. Wonderful idea. Thank you, Grace. And we'd love to. We were thinking of doing a little bit of a refresh of our program book too. So, because sometimes I don't know, I'd love to hear from you, but folks say that it's hard to find a room. It's not like all at a glance. Sometimes you're kind of thumbing through pages to see where you need to go. So, the day at a glance with rooms and topics and things, we might want to do that a little better, and we might riff off of the California Breastfeeding Summit program book as well. So we are exploring that. But one of the things that's not on our timeline is probably bringing you a design of the program book as well.
Layout.
Yes. Great. Well, thank you all so much. We couldn't do this without you. If there are any closing thoughts, this is the time. Thank you all. I see a lot of chats coming in. Thank you, Stephanie. Thanks, everyone.
Thank you.
Bye.
Bye.
Thanks. Bye.
All right. Thank you. Bye.
Thank you.